안녕하세요.
Good afternoon.
지금부터 코로나
We'll now
시대
begin
사회적 돌봄의
the web
위기와 여성
conference
노동을
on
주제로
a
웹
crisis
컨퍼런스를
of public care
시작하겠습니다.
system and women's labor
저는
in the
사회를
time of
맡은 서울시
COVID-19.
여성가족재단
My name is Lee
성평등
Eun-hee,
사업본부장
heading the Gender
이은희입니다.
Equality team at Seoul
오늘
Foundation
서울시
for Women and
여성가족재단과
Family.
후아르위원회,
The foundation and the Women Transforming Cities and Huairou Commission and Metropolis are co-sponsoring today's conference, and I would like to thank everyone for joining us today. Before we begin the keynote speech, we'll hear the welcoming and opening remarks from the organizing institutions, and we'll first invite Dayoung Song.
Good afternoon. I'm Song Da-young, Assistant Mayor of the Women and Family Affairs Office. I welcome all of you to this webinar on the crisis of public care system and women labor at the time of COVID-19. This is being co-hosted by Seoul Foundation of Women and Family, Huairou Commission, and Women Transforming Cities and Metropolis. Everyone is having a hard time since the onset of COVID-19. Korea, where the disease started to spread from February, has mandated social distancing and taking hygiene measures to stop the transmission. Thanks to sanitation measures and the rule-abiding public, Korea is faring well in terms of viral containment. Korea has made numerous efforts for gender equality with substantial achievements at hand, but due to the prolonged viral spread, we are seeing gender disparity aggravating in many parts of the world, and the economy is slowing down, and women unemployment rate is rising while employment rate is going down. Gender inequality is deepening even in the field of care, and gender violence is increasing around the world. So women and gender equality, I believe, is at stake. In order to tackle this situation, we need to clearly understand how gender inequality is unfolding, especially in this time of coronavirus, and to find ways to address this issue. This is why we are having this webinar. Today, we will be talking about the crisis that we are facing in public care and women labor. Starting with a keynote address by Professor Eva Gitay, we will have experts talking about how to respond to this matter at a city level. This will be a good opportunity for us to learn and share ideas, and I'm sure the Seoul Metropolitan Government will get many help in developing relevant policies. Thank you again for your participation, and I hope you find this event useful and meaningful as well. Thank you very much.
Next, Violet Shubisich, Chair of the Huairou Commission, is going to give her remarks.
Thank you so much. My name is Violet Shubitse. My background is caregiving, and I'm the Global Chair of Huairou Commission. I am going to give my remarks in relation to what is happening in Africa. In Africa, this is not the first time the grassroots women are finding a very big burden of caregiving. When HIV struck in Africa in 1990s, many of us came up and organized ourselves in groups to respond to the number of sick people that were in homes through home-based caregiving. This is the time when the social adjustment programs had started functioning, and people would not be admitted in health facilities for this long-term illness, which was related to HIV. The grassroots women continued to shoulder the burden of caregiving, and then orphans also became an issue where many families were left, many children were left without parents, and the grassroots women caregivers also took this as a burden. In the current crisis of COVID-19, grassroots women also are organizing in big numbers to ensure food security, to ensure the hard-to-reach people like the elderly, people who are sick, are being reached by government to collect data, and the burden of care, especially with the sanction of staying home, has really increased for grassroots women. It is from this that the grassroots women are now really partnering with governments and other institutions to look at the best way to implement care activities. With the experience of our HIV/AIDS in Africa, where we have been looking at social protection systems that are happening in Africa that do not really reach these people in a more sustainable manner, grassroots women are demonstrating what social protection means, right from supporting women, widows to be able to access land, to enhance food security, issues around basic service delivery like water and other things that need families to function. We are also looking at how to position grassroots women caregivers in policy discussions and policy dialogues, which we are indeed doing. Right now, my own organization is looking at land governance, which has really hindered many women to access land, to be able to vent and get food for families and even livelihood, especially in rural communities. We are joining the world in showcasing what the role of women in caregiving, especially in rural communities and poor informants, look like, and how best to ensure that this burden of care is shared by everyone, and the grassroots women work as caregivers is supported by governments and development partners. We are also looking at how best to position caregivers, not to call them vulnerable groups and call them small projects, but how to learn from caregivers' innovations of sustaining families, of being able to bring social advancement activities in the community, to be able to use these models to replicate them in other countries and promote peer learning between grassroots women and even governments and development partners, so that
it seems that we have very bad connection.
At this moment, I'd like to invite Joy Amasahara from the WTC to give us a word of remark.
Yes, hello. I'm Joy Masahara, co-chair of Women Transforming Cities International Society, and I'm speaking to you from Vancouver, Canada. I'd like to acknowledge that I'm living and working in the unceded territory of the Indigenous peoples of Canada here in Vancouver. That is the Musqueam, Squamish, and Tsleil-Waututh peoples. So we are certainly living through an incredible time, and we know that COVID is shining a spotlight on inequities in our world, particularly those affecting women, diverse women, and other disadvantaged communities. I hope that today's session will give us insights from around the world, as well as ideas for action. So I'd like to thank the organizers of this event, in particular the Seoul Foundation of Women and Family. I'd also like to welcome and thank all the speakers participating today. Thank you for sharing, and of course, a warm welcome to all of you listening and watching from wherever you are on the planet, whatever time zone you are in. Here it's quite late at night. So from all of us at Women Transforming Cities, we are a global community here to help make positive change. Thank you.
Next, Laura Perez Castano of Metropolis is going to give us her remarks.
Good morning, I'm Laura Pérez Castaño, Deputy Mayor of Social Rights in Barcelona City Council and also a President of Metropolis Women. Here is too early, it's 8 o'clock in the morning, but it's really a pleasure and I want to thank the organizers for this webinar. The outbreak of the COVID pandemic has had and will continue to have consequences on all aspects in life in urban areas. Local, regional, and metropolitan governments around the world have stepped up to the challenge and are responding quickly and creatively to unprecedented difficulties. But they are also reacting to the opportunities that have arisen by rethinking the role of the cities and metropolitan areas in emergency situations. The global crisis caused by the COVID outbreak has pushed cities of all shapes and sizes into immediate action. In response to the urgent demands presented by the pandemic, Metropolis launched the platform Cities for Global Health last March with support from Barcelona City Council. Our first step was to collate cities' initial response efforts, aiming to provide local and regional governments, as well as city leaders, with inspiring ideas, tools, and solutions to respond to the COVID crisis. We also aim to explore and improve new forms of city-to-city cooperation between administrations across different levels, both during the emergency and beyond. Since then, we have showcased multiple examples of crisis management initiatives from around the world. Today, more than 100 cities from 34 countries have shared a total of 650 initiatives. 54 of them are focused on gender. The pandemic also offers us an opportunity with which we should not miss to rethink our cities in relation to public space, mobility, density, local businesses, adequate housing, and key infrastructures. It's a moment to mainstream gender issues and better protect citizens' rights.
Lastly, I would like to invite Lee Young-sil, Chair of Seoul City Council Social Welfare Committee, will give us a remark. Good afternoon, I'm Young-sil Lee, Chair of the Social Welfare Committee from the Seoul City Council. I'd like to congratulate the hosting of this webinar on the crisis of public care system and women labor at this time of COVID-19. And I would also like to thank you for taking part amid the virus situation. As the global pandemic continues, social activity is being limited and care work has become a primary work for women. Poor economic performance is also unearthing the ever-existing problem of gender disparity. This is what we want to delve into: gender disparity in the labor market and care work mostly imposed on women. We will have a keynote address by Professor Eva Kitay and also share views with experts from Spain, Sweden, Malaysia, Canada, and Kenya. So I do have high expectations. As we prepare for a post-COVID world, I believe what we have touched upon today will be a major contribution in building a gender-equal working environment. I hope the discussion we have today will serve well in understanding the issues related with women labor and care in this time of coronavirus. The City Council will do our best as well.
We'll now begin the web conference. Now I'm going to invite Professor Hee-Gang Kim of Korea University to serve as the moderator. Good afternoon. My name is Hee-Gang Kim of Korea University. We will first hear the keynote speech by Professor Eva Kitay. And Professor Kitay is a distinguished professor emerita of the Department of Philosophy at Stony Brook University. She's a renowned scholar in the gender issues. Professor, hello, Professor. Can you hear us? I think you came to Korea 2 years ago. I'm so happy to see you again, although this is through virtual methods. And I understand that you're going to talk to us about COVID care and gender. So, Professor, would you begin your presentation?
Certainly. Do you want to put the slide on? Good. Okay. I want to thank the organizers. I don't know which way my, okay, there we are. No, there we are. No, there we are. I want to thank the organizers for this very, very important conference. It's, I see that the problems are global. I think some of the resolutions may be local, but many will be global as well, I think. It's now become a truism, if not a cliche, to say that COVID has shined a searchlight on a nation's weaknesses and injustices. And nowhere is this clearer than in the United States. Slide, please. Slide again. Click again. Tiny invisible viruses have forced the shutdown of the largest economy in the world and has resulted in more deaths per population than any other developed country. Those hurt most by the direct effects of the disease are the most precarious. Racial minorities, especially African Americans, Native Americans, and Latinx, people over 65, and those with underlying health conditions. Also the disabled, and most especially the intellectually and developmentally disabled, who have 3 times the death rate as the general population. The economic hit and the emotional strain has been hardest on women. The New York Times, the newspaper of record, is a set of headlines I've posted here. The school begins, mothers working retail feel extra burden. Many women in the US work retail, probably all over. How women are getting squeezed by the pandemic, how millions of women became most essential workers, pandemic imperils, promotions for women, and the one I like best is why some women call this recession a she session. Can we go to the next one? Black women, the burden on Black women has been particularly great, facing both, here are some headlines again, facing both COVID-19 and racism, Black women are carrying a particularly heavy burden. On the front lines of work at home, the disproportionate economic effects of the coronavirus pandemic on women of color, health inequities are now really brought very much to the fore. For Black women, COVID-19 has been a heavy burden. Such disparate impacts, Such disparate impacts are found all over the world, and doubtless the pain is greatest in poorest nations. Slide. But one would think that the world's largest, biggest economy, slide please, would at least soften the blow. And this is, and this simply hasn't happened. Without doubt, one of, if not the worst administration in US history happens to be in charge. All the US wealth and know-how fails flat without national leadership. Slide, please. But leadership alone is not to blame. Before the pandemic, took millions of Americans, got millions of Americans sick, millions of Americans still lacked health care insurance, I'm sorry. Most had few paid family leave, still not enshrined in national law. Most paid caregivers do not make a living wage. Many take several jobs. There is little or no training of care workers or care work, and care work is regarded on the same skill level, the prestige level, as janitorial work. Slide. The holes in the medical care and a public care system are many, with rural people, working poor, the disabled, and racial minorities. And these are reflected in the significant health disparities when these are compared to the more privileged. Many congregate facilities that care for elderly and the very significantly disabled are understaffed and under-resourced, with prisons and detention centers for migrants often busting at the seams. Women bear the brunt of the unpaid care work, even as they constitute nearly half of the workforce. In other words, even prior to the pandemic, the care infrastructure was poor compared to other wealthy nations. Add a highly contagious and sometimes debilitating and deadly virus, and one can forecast that even without an incompetent leadership, the US might still have fared poorly. Slide. Therefore, I want to suggest that the ability of a country to weather a crisis without putting unfair strain on women depends less on a country's GDP and more on the quality of pre-crisis care infrastructure. The comparative measure needs to be validated, of course, by empirical scientists, and I hope they will. My contribution here is to offer a theoretical framework that would predict such an outcome. Slide. I will first explain what I mean by care infrastructure and a robust care infrastructure, that is to say, one that is just and caring, and then move to the theoretical framework. And at the end, I will return to the need for robust care infrastructure, which I sometimes call public ethic of care, or caring about care. Slide. Worldwide, care infrastructures have been limited to mostly unpaid work of women, often supplemented by poorly paid labor of more marginal women. The American system of chattel slavery is a case of a care infrastructure, but it's one that depended on domestic slaves who took care of white children. Past slavery, that system evolved into low-wage care work done mostly by Black and then later women of color and immigrants. This care infrastructure came with stereotypes of Black women as at once natural caregivers, but irresponsible mothers, a convenient contradiction for those who want to exploit the labor. Slide. Such infrastructures are both limited and unjust. They provide care to some, those who are at once dependent but privileged, or connected to those with privilege. Yet in a crisis such as COVID, although it is without question hardest on those less privileged, without a just care infrastructure, many of the more privileged also suffer. Slide. In a condition of plague, an extremely infectious and capricious virus may hit some more than others, but no one can know they are immune. Donald Trump's preposterous self-aggrandizing statements notwithstanding. Thus, all have a vested interest in care for the many, not just the few. Furthermore, a good care infrastructure needs to support the emotional and physical stresses of being part of a unit in which care occurs. And that includes attention to the grief of loved ones in illness or death. Slide. A robust infrastructure is one that promotes the virtues of caring for and about one another. Slide. Some of the articles whose headlines I cited earlier treat the additional stresses of caregiving in the pandemic as requiring better coping mechanisms, meditation time, breaks for oneself, etc. These are band-aids at worst that ignore the deep injustices. Slide. In my book, my 1999 book, Love's Labor, I developed what I call a dependency critique of the standard view of the equality of women. The standard view is that women need to be permitted to operate in the fields and positions that men have dominated in order to be equal, independent, and liberated. What stands in the way is, first of all, legal obstacles. When legal obstacles are removed, we are left with misogyny, sexual harassment, violence, abuse, stereotyping, and patriarchal attitudes about the true place of women's, about the place of women in a man's world. Slide. The standard view is founded on a liberal conception of the individual as free, equal, rational, able-bodied, able-minded, and most importantly, as independent, who are supposed to share burdens and compete for the benefits of social cooperation. Slide. To accept this view of society neglects the ineluctable fact of human dependency. We all also experience periods of dependency, for we are born totally dependent, and as we grow out of these dependencies, we are never truly independent, but we move on to interdependence. Even so, we all are likely to encounter periods of time when we need care and when we become frail in old age, and these too are periods of extreme dependency. Some retain, slide please, some remain highly dependent because of some chronic condition or disability, such as is the case with my 50-year-old daughter. She's actually 48 in that picture, who, because of a rare genetic condition, has always been and will continue to be entirely dependent. I call these inevitable human dependencies. Some dependencies are pernicious. Those dependencies which are manufactured through manipulation, exploitation, or other justices, for example, the slave's dependence on the master for basic sustenance, the prostitute's dependence on her pimp for protection. Native populations have been made dependent by colonial rule, and women's economic dependency on men when they are deprived of the opportunity to earn money. But inevitable human dependency is neither good nor bad. It's simply a fact of human existence. Slide. As every human society will have dependents who are in need of care, someone has to do the caring. That falls, as we know, mostly on women. Slide. So a major difficulty with the standard aspiration to gender equality is that while women have been crossing over the gender divide to the labor reserved for men, few men have crossed over to the woman's side. If everyone were to lead fully independent lives, lives that answer only to our own aspirations of self-reliance and self-sufficiency, then, as the conservatives ask, who will take care of the children? Who will tend to the ailing? Who will assist the disabled or the frail elderly? That is, who is to make life livable for those who cannot even aspire to the livable ideal of the able-bodied, rational, independent actor? Furthermore, those tasked with the care of dependents themselves become dependent by taking on the care of dependents. They need others both to share the care work and to provide for themselves, and what they need to do the caring and to sustain themselves. When they do step into the competition, they do so with one foot dragging. Now, hold that image and think of what coronavirus adds to that load. Dependency care is generally done outside the public eye as women enter into the labor market in increasing numbers. The fact of inevitable human dependence becomes visible. The fact of inevitable human dependency is often easy to forget as children grow older, the ill get well. But having lived for 50 years with a wonderful daughter who is totally dependent, unable to do any self-care, including eating without assistance, I have seen dependency up close and for years on end. And so from my vantage point, the inevitability of dependency and what it requires has never left my view. Therefore, from where I stand, it seems clear that women's struggle for equality is at once a struggle for the public recognition and support for dependency work. Moreover, from where I stand, it also seems clear that the nature of our social obligations begin with the care of dependents, without whom humanity would not last one generation. Care. Slide. Caring about a robust care infrastructure. The fact is that really no one raises a child on their own, nor can anyone do so in terms of other inevitable dependencies. There are spouses, grandparents, kin, neighbors, paid caregivers, teachers, therapists, doctors, nurses, sometimes social workers, and friends who assist in the care or provisioning needed to raise a child or care for an adult dependent. When no one else is around, when government programs, vaulted in some nations like ours, very frayed safety net, are called upon, the burdens are exponentially increased. Next slide, please. Next slide. The price women are paying in the COVID pandemic comes from dissembling fragile structures that have been in place to make it possible, though not easy, for women to move out of her assigned place as a dependency worker. School closed, daycares closed, services needed for disabilities are unavailable or have been cut. Hospitals are scary, doctors' offices are closed, friends and relatives who have helped are quarantined. Furthermore, caregiving cannot be done while social distancing. And if we have been assisting in care, we are instead supposed to stay home, isolating us from those we care about, and forced into an independence we don't want. Slide. A contagious virus knows no independent individuals. Its boundaries are not the boundaries of our skin. It relies on the inevitable sociality of human beings. But that standing apart is neither desirable nor sustainable or even possible. Our vulnerability is, however, also our defense. Bonds of care minimize and can even defeat the power and reach of COVID-19. Still, women cannot and must not be asked to continue to spin the webs of care out of their own bodies. The connective tissues of care require a robust care infrastructure, able to withstand the sort of crises we face, not only COVID-19, but the looming calamity of climate change, confronting racial injustice existing not only in the US, but in nations all over that are built on colonial rule. Slide. What sort of care infrastructure would a just and caring society have? When do we have a public ethic of care? A care infrastructure is guided by a public ethic of care, that is guided by a public ethic of care, would first need to reach all. A faulty and uncaring system provides the least care to those who do the most caring. Second, it would need to be degendered. Men must share caring, not merely help out. And third, it would require social institutions and the virtues that we have to value and support care. And let me take them in turn. Slide. First, care. When I speak of care here, I mean good care. Care as it ought to be, not necessarily care as we find it to be, which is sometimes quite inadequate. But good care needs to be available to all who need it. A transportation infrastructure that carries only Mercedes and Maseratis is of no use to most. In Lisbon, during the reign of Portugal's dictator Salazar, visited, and there stood a magnificent bridge there. Hardly anyone used it. People chose a more time-consuming route on poor roads because the toll of the bridge was too expensive for most. When healthcare costs are too many for many, when health insurance is unavailable to millions, the magnificent medical institutions are of no more use to those who cannot afford it than Salazar's unused and so useless bridge is. Healthcare is as fundamental to a system of care as are highways that traverse a nation and link countries. Just as we expect roads to be accessible to all, so healthcare needs to be accessible and affordable to all. This alone would have reduced the pain in the US. Next slide. Second, care needs to be degendered. If someone has to stay home with a sick child, it is the parent who earns less that stays home. Women's wages are likely to be lower than a man's. In a pandemic, if a woman cannot go to daycare or school, it's the woman who forgoes her salary, cuts back on employment, or suffers the most stress if she struggles to both bring her full salary and care and school a child. This consequence is overdetermined. A gendered view of care presumes the woman will be less invested in her work than men, who will still remain primary, if not the sole provider. This presumption, in turn, justifies paying women less. Then, by taking time away from paid employment, women lose valuable time accruing work experience that would have translated into higher wages over time. She then has less savings that could stay her in time of crisis. Even in normal times, women and children make up the brunt of the US and the world's poor. The ideas I set forth in Love's Labor back in the 1990s have proved to be correct. Women's inability to gain equality with men in the public arena is in large measure due to the failure of society to see dependency care as a public responsibility, and the consequences are amplified by COVID. Slide. And so a third responsibility, a third requirement for robust infrastructure care is the recognition that the care of dependents ought not to be the sole responsibility of families, even when both spouses contribute, nor should it be based on exploitative paid women's labor. It requires the support of the larger society. We need investment in resources, thoughtful planning and policies that are not there for good times only. Again, consider the closure of schools that has made domestic life so difficult for so many women, so many families, especially women. Granted that schools need to be closed at the outset of the pandemic, but where was the thought of how to do childcare and teaching safely as we moved past the initial period? Zoom technology helps, but it's not an adequate solution. Where was the planning for a pandemic that would stockpile personal protective equipment? We stockpile weapons in times of peace, so they will be available in times of war. Where were the stockpiles that would make care possible? We planned for how to mobilize the private sector to produce what a military needs in time of war. Where were the plans of how to mobilize the private sector to build ventilators, provide personal protective equipment, provide testing equipment, provide places for people to quarantine, expand the hospital ICU facilities? Bridges were not built to hold up only in good weather. They are engineered to withstand winds far more powerful than normal meteorological conditions. Well, one might say, we expect a war to be a possibility, but who expected a pandemic? Many people did. And those who listened, like the agency that runs my daughter's group home, have so far lost no residents to COVID. And the staff likewise has remained safe. How much better we would have fared if this was a national requirement backed with resources to make it possible. We have allowed nursing homes and other places that deal with extremely fragile populations to operate without adequate policies, plans, or resources to withstand COVID or most any crisis. Even in normal times, the nursing homes hit hardest with those with the least resources. Sick pay attention to the architecture of congregate living facilities, care for the caregiving staff are all part of a care infrastructure that is sadly missing, at least in the United States. In the US, we have mostly a privatized medical system answerable to market forces and arguably so unable to withstand the tsunami of the COVID-19. The monetary losses occasioned by the cessation of normal medical operations has meant laying off the very people who risked their lives at the height of the crisis to care for the sick. I don't know if people realize this, but many nurses have been laid off. And these are in large measure women and people of color. The US has wealth enough to supply what is needed. It lacks the political will because it fails to see that care is at the heart of any decent and just society. So let me conclude now. Conceiving of society in terms of liberal Western vision of the able-bodied and able-minded actors makes it seem that productivity is the point of social organization. But this is backwards. Slide. In architecture, we speak of spandrels, triangular forms created as a byproduct of a curved arch. The care of dependence is the arch. Our system of politics, culture, economics, and so forth are the spandrels, beautiful and inevitable, but it is the arch, not the spandrels, that hold up the structure. The arches are the care infrastructure. The sturdier they are, the better they can weather the storms. The true nature of human equality lies in the fact that we are all some mother's child, and the societies we form are comprised not of fictive, independent actors, but connected, dependent, embodied, and vulnerable beings. Society is held up by nested dependencies, arches embedded in arches. Its central role is to care for those who need care, and its central virtue lies in caring for and about each other. Thank you.
예, 교수님 흥미롭고 의미 있는 연설
Professor,
잘
that was an
들었습니다.
excellent
감사합니다.
talk. We found that quite
시간
interesting.
관계상
And in the
질문을
interest
한
of
가지만
time,
할 수
I
있을
think
것
I'll
같은데요.
only be able to ask one
교수님
question.
연설에서
In your
Public
presentation,
Ethics of
you
Care에
talked about
인도된
public
care
ethics of care,
infrastructure,
and then you
그러니까
talked about care infrastructure.
guided by the
And
public
care,
ethics of
you said
care의
that public
필요성과
infrastructure are
정당성에
guided
대해서
by
말씀해
public
주셨습니다.
ethics. So you talked about the
한국
need
같은 경우는
to have
전
a
국민
care
의료보험
infrastructure.
제도가 있어서
Here in Korea, we have a
national
universal
healthcare
healthcare system. So everyone in Korea has a health insurance. So compared to the United States, well, I think Koreans are better off in terms of healthcare. But the care is still gender based. So how can we promote more participation by men? And have everyone realize that care is a social responsibility. Can we develop policies? Can we develop institutions? To make sure that care is a shared responsibility.
It seems to me that it's certainly possible. It lacks the political will. And in countries as wealthy as the United States, but also Korea, the resources are there. They are there. We just have to use them. We have to decide that some of the resources we have need to be diverted. And it's really not a diversion. It's the essential work of a society to provide care and to help care take place. As far as men entering the women's side of the divide, that takes a number of different policies. I would say that it really needs to start at elementary school level. You need to have boys who are trained in care, who are shown that caring is something that they need to learn. We need to understand that caring is not just a byproduct of the X gene, of the X chromosome, that this is possible for boys and girls, and then one works one way all the way up. Sweden has, of course, taken very innovative measures using paid family leave, which, as I said, we don't even have in this country. Using paid family leave to try to restructure this phenomenon of women making less and therefore they take more time off and so forth. And also to change the whole public perception of what it is to be a man. Sounds like a big change, but big changes have happened, and sometimes they happen very quickly. And I mean, if there are ways of using this crisis to underscore the need, it would be really important. But I do want to say that even if both men and women are at home, it still doesn't do the whole work. You still need social institutions that are going to pick up a good part of the burden. And it's rather extraordinary that more thought was not given to how to get children in schools without, and at the beginning, of course, we knew nothing. But now we don't know nothing. And it's still an incredible struggle, at least here in the United States. Planning, thought, will, political will, and I guess a lot of grassroots organization.
예, 감사합니다. 현재 뉴욕 시간이
Thank you
새벽
very much.
2시라고
I
들었는데
think
늦은
in
시간에
New
이렇게
York
참여해
the
주셔서
time is
감사드립니다.
early morning around 2
예,
o'clock. Thank you
감사합니다.
very much for your participation in very early in the morning.
예, 다음은 서울을 비롯해서
Now
스페인,
we would like
말레이시아,
to have
캐나다, 스웨덴의
representative
각
from
도시 발표를
Seoul
들어보도록
and
하겠습니다.
major cities around the world
시작하기에 앞서
to have
먼저
a
양해의
city
말씀을
presentation.
전달드립니다.
I would like
앞서
to make
오프닝에서
a apology
말씀드렸듯이 오늘
beforehand, as I
바이올렛
have
스티프스의
said.
후아류 위원회 의장님께서
The
케냐
chair
사례
of
발표를 하시기로
Huairou
하셨는데
Commission, she
급한
was
사정이
supposed to
계셔서
make
별표엔
a presentation
참석하지
for
못하게
Kenya,
되셨습니다.
but because
양해
of
부탁드립니다.
prior
그럼
commitments,
먼저
she's
스페인
unable to make the
바르셀로나
presentation
Deputy
now.
Mayor
I would
of
like
Social Rights, Global
to
Justice,
invite
Feminism,
Deputy Mayor
and
of Social Rights, Global
LGBTI
Justice,
of
Feminism and
Barcelona City
LGBTI of Barcelona City
Council,
Council, President of Metropolis
Women,
Women,
라우라 페레즈
Ms. Laura Perez
카스타노님의 도시 발제가
Castano.
있겠습니다.
She will give us a city
준비되셨습니까?
presentation. Are you ready to give us a presentation?
네,
Yes, I
발표해
am.
주십시오.
Thank you
Would
very
you please
much
start?
again. Good morning. Little ideas about the situation of Barcelona right now, about the COVID situation. Barcelona is now suffering an increase of infections, and last week the Catalan government adopted harder prevention measures. These measures will mainly affect bars and restaurants and limit the visitors' capacities of shops, gyms, and cultural centers. This is necessary from the viewpoint of health, but these measures will certainly put people out of work and make life precariousness of many sectors. The pandemic has highlighted the problem of feminization of poverty. We need to address the crisis through feminism and the defense of collective interest. Also, the emergency has reminded us that we are vulnerable, interdependent, and eco-dependent individuals. Solutions necessarily have to prioritize our needs of care work. The pandemic has also put the spotlight on the feminization of precariousness. Already before the COVID, women suffer worse labor conditions than men. More temporary and more part-time jobs concentrated in sectors with a smaller salary, a 26 salary gap actually in Spain. The COVID social and economic crisis has provoked a notable deterioration in the work and financial situation of women, especially the most precarious ones. In Spain, ERTs have helped millions of workers, but many women who used to work in the informal economy or were in an irregular administrative situation have not been able to resort to ERTs. Many of the essential tasks during the lockdown have been highly feminized. Care work, residence, healthcare sector, cleanings, supermarkets. Therefore, these workers have suffering overload, exposures to infection, anxiety. In addition, we have seen how women have been taking on by far most of the burden of care of children, old people, and dependents. The lockdown has made this care work all more intense. There are certain groups of women that find themselves in an especially vulnerable situation. Migrant women, above all, those without their papers in order, women with low qualification, women in gender violence situation, domestic workers, single family heads, sex workers, and victims of human trafficking, among others. Also, the LGTB community. The LGTB community may also be strongly affected by the COVID impact on employment. We are especially concerned about the situation trans people may come across, and trans women in particular, seeing that they are already a group with an enormous proportion of unemployment, discrimination, and work exclusion. Let's talk about the Barcelona's policies on female care work. Before COVID, our government implemented active employment policies with a gender perspective, which have proven useful to mitigate the impact of the crisis on women. During 2018 and 2019 period, we assist 6,000 women with various social and job placement programs, and 1,300 women are taking part in comprehensive recruitment projects. We intend to reinforce our policies to tackle the feminization of precariousness and promote female occupations. Support to workers in highly feminized sectors, such as family life balancing measures and training programs. For example, a flexi-time employment contract for family workers or child carers for women taking part in these programs. Programs for relocating unemployment women from the sectors affected by the COVID crisis through a specific training in collaboration with companies. Work programs aim at groups with more difficulties. For example, municipal employment plans for women in vulnerable situations, single parent women, women in gender violence situation, sex workers as employment alternatives, LGTB collective in vulnerable situations, and which are the answers of this crisis from a gender perspective. Given the impact of COVID on care workers, our City Council has reinforced its main service and create others to take on this crisis from a feminist angle. We have put special attention to reinforce care-related policies. During the crisis, we have attended 375 domestic workers providing emotional and psychological support, health consultations with self-protection and prevention of COVID care, a guide to COVID-related resources and materials for disseminating information of interest to domestic and care workers, legal and employment advice and information on calls for aid, dissemination of works and training offers. Also want to close talking about the future policies, aware of the consequences of the pandemic and the social and economic crisis on women and the most vulnerable groups. We are developing future strategies focused on women to guarantee their incomes and protect their social rights. These policies will need to take into account the impact of the crisis on different groups of women. Measures to ensure the access of migrant and refugee women to health, employment, food, and information services. As for family work balance, we have been drafting a telework guide with a gender perspective and working to support companies in introducing telework and time use measures with a gender perspective. The aim is avoiding that worsen the salary gap or gender inequalities. Local services of caregiving for children in order to facilitate life-work balance for working families. Concilia pilot project is 7 days a week aimed at single-parent families or with little support networks for enabling participation in training, incorporation in the labor world and personal life. Also, expansion of the caregiving services. We have passed a reform to improve the home assistance services. Main municipal care contact employment some 4,500 women workers. It's a 34% increase in service hours and improve labor conditions. And also to reinforce the support for care workers, advice and guides on employment rights and recruitment. Despite our limited resources as a local government, we have been doing everything in our hands to solve the immediate and urgent problems of the most vulnerable women and sectors during this crisis. But we do need further investments and, above all, a reconsideration of the priorities and economic system. After this crisis, care work cannot be forgotten anymore because it is the basis of our lives and societies. Thank you very much.
네, 라우라
Yes,
페레스
thank you.
카스타노
That
부위원장님
was
수고하셨습니다.
Laura
부위원장님께서는 아쉽게도
of
다음 일정에
the City
계셔서
Council
패널 토론에는
of
참가하지
Barcelona.
못하시고
She will not be able to join us for the panel
하시네요.
discussion, unfortunately.
감사합니다.
So I would like to thank you for
다음은
joining us.
서울시의 발제가 있겠습니다.
Now we hear the presentation from the Seoul
서울시
City,
여성가족재단
and
백미순
Baek
대표이사님께서 발표해
will be the
주시겠습니다.
president of Seoul Foundation of Women and Family will be making the presentation. Good afternoon. As was introduced, my name is Mi-sun Baek of the foundation. Well, we are having this conference at and we are all living in different time period. And I'll be talking to you about Seoul. And not much time has been given to us. And in order to save time, I will read the script rather quickly, the one that I prepared for today's conference. The social distancing and the quarantine were selected, and in the care services in the public and the private sector have stopped, and the care is now given it's up to an individual. And here in Korea, well, it has become rather equal. It seemed it has become equal. However, care was mostly up to women, and in this time of crisis, well, the stereotypes about the care has become, in fact, strengthened in Korea. So women have to work for paid work, but they also have to care for the family. And sometimes they have to give up work in order to be able to take care of the family. That's the case for women here in Korea. And Korea has the widest gap in pay between men and women. And women, low-paid women, are becoming the victims. And according to statistics here in Korea, the Korean women's economic participation and the employment in September of this year declined by 1.2% and 1.5% compared to the same period last year. And the number of women employed declined by 2.4%. So women employment declined 3 times more than men. And also because of the COVID in Q1 and Q2, the temporary time off that was about 460,000 and 750,000. And most of those took time off were women and the people who were self-employed. So women, there were 410,000 more women taking time off from work. And women made up about 60% of the temporary jobs. And because women had the temporary jobs, they were more vulnerable to COVID-19. And also women work in areas such as welfare and the hospitality and the restaurants. That is why women have lost more jobs. And also women have to give up economic activities because they have to look after the children, the family members. And in the first half of this year, well, men taking family leave increased 34%. But that's still 1/3 of the family leave that women had to take. And also about 2.5 more women than men were asked for the allowance or the time to take time off to take care of family and the family members. And quite a lot of women answered that if the crisis continues, they will have to take time off to look after the children and the family members. And the government and the city of Seoul are providing emergency care services. And with the COVID-19, nurseries in the schools and the daycare centers, instead of closing all of them, we are converting them so that they can provide emergency care services. And so the community care facilities and the community are also converted to provide emergency care services. And these care services are for the less privileged families. And with the COVID-19, we have a lot of people who are quarantined, and the elderly and the disabled who are quarantined. We're providing visit home care services, and we're trying to expand more family leaves and also the allowances for the family and so-called essential workers. We want to make sure that they have employment and stability. With the child care facilities and nurseries, although children may not come because of they're worried about the COVID-19, we're making sure that the teachers and the service providers at these facilities are able to keep their jobs. We are providing the necessary subsidies from the government so that these people can maintain their employment. And we're also trying to provide support to those that are looking after the people with the disability as well as elderly. So we believe that this is one way that we can increase care by the community. And we also, there are people who need to maintain face-to-face work. And there is a district called the Seongdong district in the city of Seoul, and they have come up with the enactments, and as well as the city of Seoul with an enactment to provide special support to the essential workers. And we're also trying to promote more child leaves by men. And we are also trying to set up so-called smart work centers near, the homes of women, so that women can save time commuting to work and have an easier time to look after the family members. The city of Seoul and this crisis of care are coming up with the emergency measures, but fundamentally we need to enhance the public aspect of care. And this is in line with what the Professor Kitte has said. We have to reduce the gender inequality when it comes to care. And we also need to increase the social responsibility of care. We don't think that COVID-19 is going to go away anytime soon. And we'll also have other pandemics in the future. So we need to have more systems in place for non-face-to-face care. And care work, which is more face-to-face, and need to be provided more actively for those who require this sort of care. With that, I would like to conclude my talk. Thank you.
예, 대표님 감사합니다.
Thank you very much for your presentation.
페낭주 사회개발부 장관님의 발표가
We
이어서
will have a
진행되겠습니다.
presentation
앵총
from
장관님
Penang
준비되셨나요?
State and Chong. Are you ready?
예, 발표 부탁드리겠습니다.
Yes, thank you very much. Okay, Penang is 3 p.m. in the afternoon. Yeah. I'm in the State Assembly. We are having a Women Assembly. It's a simulation of a State Assembly. That is to give a platform for women to experience how a State Assembly is happening. Okay. Next, I would like to show, I think what Penang experience is not much different from all other cities, where women are more in formal jobs and women do most of the care work, most of the care for the children, care for the age, care for the family. So these are all the same. If you have slide, maybe you can go to the next slide. This is to show the ratio of women and men in Penang is almost 50-50. Yeah, again, I think it's very similar in other cities. Okay, next. Next is about labor force participation rate in Penang. Generally, less women working compared to men. In total, 54.1% women are working compared to 80.5%. Of course, they also have a wage gap. Gender wage gap is there. Okay. Okay. Next one. Next one is about average time spent on various activity by income class and gender. This I want to show is more women spend more time in unpaid care work. Yeah, whether it's B40 group or M40 group or T20 groups. In general, it cuts across. Women do more unpaid care works. Yeah. But for those B40, their hour is 3 hours compared to men. Women is 3.8 hours compared to men is 3 hours. Yeah. And for even the top 20 groups, women spend 2.6 hours doing unpaid care work, but for men they only spend 1.9 hours. But it's most obvious at M40 groups. In M40 groups, women spend 3.9 hours. Why? Men only spend 1.6 hours. So in general, I believe it is across the country, across the city, it is still in this kind of pattern. Okay, next. Reason of women leaving labor force in Penang, in Penang and in Malaysia, nationwide, is still the childcare problems. Women have to take care of the children. Yeah, and yesterday I just heard a case where the groom put a condition to marry a woman, his bride, that she must be willing to resign from her work, her career, and be a full-time housewife. And this is still happening. Yeah, it's still happening in Penang, and I'm sure it happens in all over the world. Yeah, and marriage problem or issue related to marriage is account for 16.4, while childcare problem is 32.4. Yeah, many women are held back by marriage and childcare. Yeah, next. Women's labor in the time of COVID-19 in Penang. Okay, go next. Employment and earnings. Male workers are more likely to be retrenched during this pandemic time. Yeah, than female counterparts. Is about 40% male and 60% male. 60% male and 40% women. But this may simply reflect that there are more men than women in the workforce. So more men are being retrenched. But generally in Penang, our direct investment are still very strong. And the job loss, while many people lost their job, but at the same time, there are also many job looking for people. Yeah? So we have a female and male comparison. The trend during January to May this year. For female, they are 431. This is not the full data. I'm sure it's not the full data. Yeah, this is only the official, those who report to us. Yeah. But for male, they are 1,236. So this is slightly different. Like, you know, female always being retrenched early first. But for this, because manufacturing lost most of the job. Most job is 800, and services 434. Yeah. Okay, next. For unpaid work, yeah. So during MCO movement restricted period, with the closure of care center, especially child care center, women are blocked down with both family caretaking work and their careers. I think this is all over the world. Everywhere, women being have to have the dual job. Yeah, take care of the family, do the cooking, take care of the children, and at the same time try to do work from home. Yeah, it's have to do work from home. So the double burden syndrome has tripled during the pandemic, and thus affected women's mental health even more than usual. Yeah, I see women have to carry babies and try to do some work from home. Okay, then we go next. What have the Penang state government did? Yeah, next. Next slide. The next slide we have the Penang People's Aid Package. That means Penang state government, of course, national government has also give out a lot of aid to those who have been affected, family and individual and business traders affected by the COVID. Yeah, but we can see that altogether Penang give out worth 76 million ringgit for the state. And for women who are in childcare, the childcare center operators, they also benefited. And also NGO and individual who are tackling domestic violence. We have give up allocated, state government allocated 100,000 for NGO who support victims of domestic violence to apply to support, to try or support their activities and programs. Okay, next. And during this time, we have the Muslims Hari Raya, where it's after Ramadan. And we, in order to show our gratitude to frontliner, and frontliner, a lot of them are female. For example, nurses, they are all female. And also doctors are many female as well. So in order to show our gratitude and also to provide a job opportunity for women from the B40 group, from poor family. So we also started to make some cake. Then we pay them the capital to make cakes and give it to the frontliners. And for this, they can make a little bit of money out of here, a small number of women. Yeah? But from there, because we foresee many men were lost their job. Just now we see more men than women lost their job. Yeah, next slide. So men will be very difficult to find a job after they lost their job. But women can do what they are good in cooking. They are cooking at home anyway, every day. So we try to we run the program where women to generate some income, a small income. It's a very small project. It started, we just started. So we identify products, food products they can sell. Women can make from their home, and we select the products they can sell, and we will help them to do marketing. Yeah, this is called women to generate some income. Yeah, by their already they have it existing skill of cooking. Yeah, so we selected 10 products for the pilot project, and we give them each one 1,000 ringgit so that they can start to produce enough product to sell. Okay, next slide. Next slide is creating new jobs for the unemployed. The state government by the Penang Career Assistant and Talent Center, CAT Center, offer job matching facilities for those who are facing retrenchment or for anyone who wants to look for a job. Penang is looking forward to create at least 13,000 new job opportunities. The center has started collecting data and detailed information to find employment opportunities. Offer help to 500 employees to Expo Group Malaysia, which closed now on June 12. Okay, so we know, next slide, now we know childcare is really important. So I take the opportunity, now people are more receptive when we say, oh, we need childcare, state will have to invest in childcare, and the government are more receptive now. So we are just starting, we just are going to start next year a scheme to help those B40 children from B40 or poor families to have a monthly subsidy of 50 ringgit. It's about 600 ringgit a year. Yeah, this is just a start. Yeah, a start. At the same time, we also say we need to have more childcare center, and we need to have a start-up grants. So start from next year, the state government has agreed to allocate 600,000 to build at least 2 childcare. Yeah, for the private partners to build 2 childcare, and we can use this startup grants, but they have to comply with the government's condition. That is, the fees must be affordable, no more than 500 ringgit a month. So during this period, we also started to collect sex disaggregated data on government's aid. Yeah, next slide. Yeah, we have not done this before, but now we know that, you know, who is receiving the aid, how many men, how many women. Yeah, and we notice that we have 6 fisher women. We never know we have a fishermen who are female. Now we know. Yeah, so we have one of aid. There is 500 ringgit to B40 groups. We have 348 women receive the aids, and 312 men receive the aids. So it's more women receiving the aids than men. That is just to go to show that more women are poor, more women are at the poverty group. Then we have to childcare center. We also have one of 500 to childcare center, and these childcare center operators are mainly women. 104 are women and 9 are men. We also during this period, because the domestic violence has get all the attention internationally and also in Malaysia. So we also take this opportunity to put in place a safe family policy, where we're going to start first support point in many government department agencies counters, and also in the religious place and NGO, and also state assembly's office. This is to increase the support to victims of domestic violence. So in Penang, I feel we have managed to pivotal on this crisis and find some opportunity to push forward some policy or some measure that is gender-based. Yeah, so I think it's not all bad. So and sometimes we can use the situation, crisis will also bring about opportunity. And that's all that I want to share with all of you. Thank you very much. Thank you. Next slide is thank you.
예, 앵총 장관님 감사합니다.
Thank you very much for your
다음은 밴쿠버로
presentation. Now we will
넘어가겠습니다.
have a presentation
엘렌
from
우즈워드
Vancouver.
Women Transforming
Ellen
Cities
Woodsworth,
의장님께서
co-chair of Women
발표해
Transforming
주시겠습니다.
Cities, will give us
안녕하세요,
a
의장님
presentation.
준비되셨나요?
Good afternoon or good morning. Are you ready to give us your
발표
presentation?
부탁드립니다.
Can you start your presentation?
Sophia.
Can you hear me?
Yes.
You can hear me?
Yes.
Okay. I'd like to thank the Seoul Foundation of Women and Family for your wonderful work. I always talk about Seoul as the best city in the world for women, and your policies are so outstanding. We're so pleased to have met you and to work with you. I'd also like to acknowledge the incredible work of the Huairou Commission. I'm sorry Violet's not here. And Professor Feder Kitte's presentation, Chong Eng, Sophia Osmark, we haven't heard yet, and Laura Perez. And I know there's exciting things happening in Barcelona and Spain with the Women Councils. I would have liked to have heard her talk about those. All over the world, we know that COVID-19 has exposed the fault lines of gender, race, citizenship, and income. It has had a devastating impact on women and girls with a massive loss of paid jobs, women on the front lines of the healthcare system in lower paid jobs, a huge increase of unpaid jobs outside and inside the home, domestic violence, and racism. All of this as climate change global crisis becomes more and more deadly, having a greater impact on women and girls. The amazing results of the pandemic is that women, youth, elders, LGBTQI2S, climate change activists, and racialized communities are rising up and calling for a new world based on a public care economy, which will include us because we are the ones doing the caring and have been doing it for centuries. Women are calling for disaggregated data because women and most of women's unpaid work goes unseen unless it is counted. If we are unseen, the solutions to the pandemics don't include us. We are demanding that all levels of government use a gendered intersectional lens on their policies, programs, budgets, funding, staffing, and governance to see who is impacted, where, and how, in order to develop a recovery strategy that includes all women and girls. To be seen, to be heard, and to get women's issues regarded in a care economy implemented, women must be at the recovery strategy meetings and in government. The 5 major areas of impact on women exposed by COVID-19 are the healthcare crisis, where women are doing the majority of healthcare work and working inside seniors' facilities. Many workers in Canada are immigrant and marginalized women with the worst working conditions and lowest wages. And we also are experiencing the same mental health crisis that women around the world are experiencing. They're the job losses and increases of unpaid work. Millions of women's paid jobs were lost in the collapsing of manufacturing, restaurants, retail, small businesses. More women than men's, significantly more women's than men's jobs were lost. And still there's almost 500,000 women in Canada without jobs. 2, there's been the huge increase in unpaid work for women in the care of children who can't attend school, although they just have started in September, but the second wave is now hitting us, so I'm not sure they will be staying in school. Partners are at home, they're taking care of seniors, and because of self-distancing, the requirements for shopping, etc., are way more. The domestic violence has just soared. In Vancouver alone, there have been over 300,000 more phone calls to the crisis line. Women have lost their jobs, so they don't have the money to leave abusers. Shelters are overfull, and there's a serious lack of affordable housing, while the sales of alcohol have gone up by 55%. Violence against the LGBTQI2S community in the home and outside the home has increased as there is nowhere to go as NGOs' offices are closed. There's an increase in exposure of racism, colonialism's impact on Indigenous peoples, and the impact of the COVID on refugees and immigrants. The Black Lives Matter movements have exposed the lack of disaggregated race data to show the disproportionate health impact of COVID-19 and violence against Indigenous, Black, Asian, and other peoples. We have been exposed and finally seen the treatment of refugees lacking healthcare, safety, food, and shelter. Immigrants doing low-income work in Canada are demanding, because they're doing the frontline work in the care facilities and in hospitals, exposing themselves to COVID-19, that they should be paid better wages and given citizenships, which is really a good step forward. Indigenous people all over the world are losing their elders, which is a death of entire cultures, their lands, and their languages, and they're calling out for help, especially in Canada. Women are fighting back, building on organizations we have already created, organizing coalitions which are making powerful declarations we present to governments stating that we don't want to go back to normal. We want a new world based on a caring, feminist, green economy. We are organizing and stepping forward for election to government. We must amplify these statements and keep strong pressures on all levels of government to act. And I have a few of some of the really good statements that have been made by different women's groups. Number one that many of us learned from was the Hawaiian State Commission on the Status of Women wrote this document, Building Bridges, Not Walking on Backs. It's very good, it's really worth reading. Two, the National YWC of Canada wrote A Feminist Approach to COVID-19. Three, Feminist Delivers, a provincial grassroots coalition led by Black and Indigenous women, wrote a feminist economic recovery plan for COVID-19. Four, the Canadian Women's Foundation wrote Resettling Normal, Funding a Thriving Women's Sector. And WIDO wrote a very good document, Feminist Agenda for a New Green Deal. Even our organization at the city level wrote a letter to our council talking about what that will look like at a city level. We are calling for a GBA plus gender-based analysis, which you can see on the Status of Women in Canada website. We're calling for disaggregated data, which is up on the website of Race Matters Institute of Just Partners. We're calling for the use of a gendered intersectional lens, and UNDP has a very good example, which is tied to the Sustainable Development Goals. Governments must recognize care work as essential work. They must invest, strengthen, and expand the care sectors: healthcare, pensions, seniors care, childcare, affordable housing, and equitable wages, as well as paid green jobs for women, and strengthen small businesses. Governments must expose and address systemic racism and attacks on Indigenous, Black, Asian, refugees, and other people, and must address the shadow pandemic of violence. Stable and substantial funding must be earmarked for nonprofits and charitable organizations, which not only engage women through their workforce, but also serve thousands of women and girls. Decision makers should engage women-led organizations and equity-seeking groups in their recovery planning, giving us direct, accessible ways to provide input and invite us directly to the recovery strategy tables. We know that it is not a lack of government money for desperately needed social programs and a new care economy, but there is a lack of political will. In Canada, billions of dollars of government money are going into defense budgets and for the fossil fuel industries. The corporations and the wealthy must be equitably taxed. Governments must resist a retreat into conservative austerity approach, where equity and social justice are seen as distinct from a sustained and meaningful economic recovery. Equity and social justice must not come second to economic recovery. A just recovery recognizes women's need for paid work and for unpaid work to be recognized and paid. The only way to build a caring economy is for women's organizations to rise up, build strong coalitions, and in coalitions we see that by lobbying we're able to force governments to respond. We must work with and elect those who amplify our goals. It is imperative that we bring women's organizations together, expand our reach, train and open positions for the new leadership that is emerging out of the Indigenous, Black, and people of color movements, youth and climate change movements, to strengthen our voice and our power. Generations of women's equality are at stake. These are some of the goals we have achieved in Canada by our pressure on all levels of government. The Prime Minister's throne speech just a couple of weeks ago said, quote, "Women, and in particular low-income women, have been hit hardest by COVID-19. This crisis has been described as a she session, and he stated that he would do the following. Number one, the federal government would develop an action plan for women in the economy. Two, a women's entrepreneurship strategy. Three, a national childcare strategy, and before and after school program cost subsidized. A disability guaranteed income is being proposed. Increased sick pay to 10 days a year. A national anti-violence strategy with funding on top of the $40 million that they have already given. Funding for housing, 1/3 of must be housing for women. Funding for LGBTQI2S people, and they have agreed to use an intersectional lens. Earlier, they gave out CERB, which is the Canadian Emergency Response Budget, for wage earners, contract workers, self-employed, and ineligible for employment insurance. That was replaced on October 4th by a $500 per week Canadian Recovery Caregiving benefit for up to 25 weeks. There's a Canadian emergency wage subsidy, help keeping jobs for businesses or to rehire in the next year. There's a Canadian Recovery Sickness benefit, will provide up to $500 a week, taxable, tax-deductible source. These are some of the things the federal government have done, and you can look at them all on the Canadian government website. The provincial response has been to set up a provincial economic task force and invite the unions to the table, women's organizations, NGOs, and economists to come up with some strategies. They have brought care workers under provincial supervision in one unionized job, well paid with benefits, rather than being forced to run around between 3 or 4 other jobs, spreading the COVID-19. They've increased $10 a day public childcare spaces by millions of dollars. There's childcare for essential workers, essential healthcare workers, and emergency responders during COVID-19. And they're temporary supplements for low-income seniors, the disabled, single mothers of $300 per month. In the cities, they have responded to our calls by trying to work with other levels of government to increase healthcare, housing, and transit funding for other levels of government. They've purchased old rundown hotels and provided shelters and more low-income housing. And they are designing a special low-income housing project just for women. They're producing more and more childcare, and they've hired a city diversity and inclusion manager reporting directly to the city manager, who's being asked to put a gendered intersectional lens on plans for economic recovery. UN Women and others have stated we may lose generations of women equality rights. It is urgent that women rise up together now in strong, bold coalitions and call for a new world based on a care economy. We need a feminist, just, new Green Deal. A new world at this time is possible, but we must fight hard together to get it. Thank you very much.
예, 감사드립니다.
Yes, thank you very
엘렌 우즈워드
much.
의장님
That
감사합니다.
was
이제 마지막 발표입니다.
Ellen Wisworth.
많이
Now we're going to move on to
기다리셨습니다.
the last
소피아
presentation. You've
웨스마크
waited a long
유년
time.
투 유년
And not
부장님이
last
스웨덴
but not
사례에
least,
대해서 발표를
speaker
해주시겠습니다.
is Sofia
안녕하세요.
Wismark of Sweden's Union to Union. Hello,
발표 부탁드리겠습니다.
please.
Thank you very much, and thank you very much for the invitation. I will try to share a presentation with you here. You see it? Does it work? Yeah.
Yes.
So thank you very much for inviting me to this conference to speak about the experience of Sweden. And firstly, I would just like to share something personal, that I'm currently actually in a home quarantine because several students in my daughter's class has tested positive for COVID-19. So I'm really living this quarantine at the moment, also waiting for our test results to come back. So it's very personal at the moment. So my name is Sofia Östmark. I'm the Secretary General of Union to Union, and Union to Union is actually the joint organization of all the Swedish trade unions for international development cooperation. So my home turf is actually really the global labor market in developing countries. But today I will speak about the experience of Sweden. But in general, I work mostly with global issues, just for you to know that. Looking at COVID-19 in Sweden, there was quite a hard hit spring for us here with a lot of people dying. So it's been a hard spring, and now we're also seeing several more cases coming back here in the last few weeks. So we have almost 6,000 people that have died due to COVID-19, and there are more men and women, and a large majority of the people that have died due to COVID-19 are either people living in special care facilities or with special care at home, so elderly people that get care at home. So that is quite a striking number, that we didn't really have the possibility to protect the elderly and the vulnerable people in our society. And that's something that later all the elderly home was closed and you couldn't visit them. Now again, there is a possibility to visit the elderly under certain circumstances. As you probably have heard and seen during the news, Sweden has taken quite a different approach to the COVID-19 situation than many of the other countries. So there has been 6 principles that the government has had as a starting point for their action. And it's about, of course, limit the spread of the infection, but also ensure that we have available healthcare resources and limit the impact on critical services in our society, and also the economic consequences to try to elevate the impact of people and companies. And also try to inform and provide daily press briefings to people, and also ensure that the right measures, of course, are taken at the right time. A lot of power on the decisions has been laying on the special agencies in Sweden, where they have a big autonomy. So they have had quite a large role in the COVID-19 strategy in Sweden. Looking at some of the strategy or the elements of this strategy, so there was never really a full lockdown of our society. But on the other hand, when you walk the streets in April, there were hardly no people there. So even though there weren't a kind of forced the lockdown, there were more or less a lockdown of society, I would say. And we have worked more with kind of advices to keep social distances, not to work from home as much as possible. And the schools has remained open during the spring. And the schools for the older children were closed, but for the younger ones and daycares and everything was open. And that, of course, was made it easier for women, which are often the primary caregivers and staying at home if schools close or preschools are closed. So this is something that stuck out a little bit from the rest of the world, where most schools closed down. They didn't see that this kind of elevated the spread of the infection during the spring, but you don't know about the teachers, for example, and how they were hit. We don't really know the facts in that matter yet, and whether most teachers still in Sweden are also women. And if you look at some of the government has come with a support structure of different measures that they have taken to kind of ease the burden on both women and men, I would say. But some of these measures are also particularly important for women, I would say. So, for example, we are now get sick pay from the first day that we are at home for being sick ourselves or for taking care of our children. Usually you have a quarantine day where you don't get paid at all, but this is something that is changed now so that you get paid for the first day that you have stayed at home. And that is, of course, to try to have people stay at home with mildest symptoms. They have also temporarily suspended the requirement of providing a medical certificate if you're home for more than 8 days. You have also temporary parental benefits when a parent needs to refrain from working for caring of a child that is in quarantine, for example, or have a special condition that needs to be at home. You also have temporary benefit for people belonging to an risk group or for falling serious with COVID-19. And in Sweden, on the labor market, there has also been introduced an expanded system of short-time work where the government goes in and pay 70% of the cost of an operation or the salary loss of that particular person. So a lot of people during the spring and also during the fall here has been working, say, 20% of the time, but still receiving about 90% of the salary, with both the company and the government paying for that salary. And there has also been new ways of putting in more benefits in relation to employment insurances that we have already through the collective agreements that we have in Sweden. 90% of our workplaces are covered by collective agreements in Sweden. So this is something that is very widespread if you compare it to other countries as well. And if you look at the economy and the labor market, in Sweden, it's estimated to fall by 4.6%, the GDP this year, and both employment rates will go down. But due to these short-term layoffs, one thinks, or the government thinks, that they have been able to save many people's life. We have had one of the lowest unemployment rates in Europe. This year, it's estimated to result in about 9% unemployment. We have, as I mentioned, a strong and quite well-functioning social dialogue in Sweden. Almost 80% of all working people are organized in a trade union in Sweden. So that really sticks out if you compare to other. And many of the employment issues has been both through social dialogue on a national level, but of course also on the kind of industry level or the company level, even, where the collective agreements also pay a certain security to both women and men. As someone else was saying also in their presentation, we have here in Sweden a social security system that is, I think we're quite known from around the world, which is both on healthcare, children care, that is for all the people. There is no, you have a kind of public insurance for both health and child care, and the schools are also free here, as you probably know. So these are some of the ground pillars that we have in our society generally, which I believe has helped quite a lot also during the COVID-19 situation. So it's not that you can come up with certain things in a particular moment when you have a crisis, but you have to have these measures in place already before the crisis comes out. And if you look at the employment rate before Corona, and we had an employment rate which is quite similar between men and women. 80% of men and 76% of women are working in Sweden. Even though we are known for our quite good gender equality work, women still earn only 70% of men's salary in Sweden overall. So not necessarily for the same work, but most women have kind of lower salary work. So for example, lower care work and others which are not paid so much. So that is quite a striking number even from Sweden, and sometimes we forget that we have work to do even at home. So if we look at the implications for women on the COVID-19 situation in Sweden, as I said, we have had measures in place, the social security system, a well-functioning social dialogue, which has helped. We did not close the schools, which is also, I think, helped a lot of women, because women are still the primary caregiver, even in Sweden, still, even though we share, it's still the primary caregiver. But there are also, I would say, challenges, and we don't have data. So I was trying to look with the Ministry of Social Affairs now before this meeting if we had any figures on some of these issues, but it hasn't really come yet. So I wasn't able to find it as of yet. But as we in Sweden, many women are very overrepresented, I would say, in care work in Sweden, both in all elderly, children, and everything. So they are more represented in those categories, which means they have more risk of infection. And we haven't seen what that will give yet, but that is a fact. As I said, women are often the primary caregivers. So when children need to be home, for example, from school due to quarantine or that they actually are sick, and it's often the women that stays at home. In Sweden, also related to the fact that we only have 70% of men's salary, women are often more also in unsecure employment, so temporary employments, not full-time, part-time employments, and so on. And that is, of course, a risk when a lot of people are losing their jobs due to COVID-19. The speaker before me talked about working from home and the women also doing other work at the same time. And we have recent studies coming out from institutions in Sweden showing that women are more likely to experience stress-related diseases during this period, where a lot of people, the majority of people are working from home if they can do that. And that means they are also at the same time taking care of children that can't be in school, cooking, or whatever homework they are doing. So we have already seen that stress-related illnesses are higher on women than on men. And as others were also pointing to from other parts of the world, we have also seen an increase in domestic violence and gender-based violence. And we have now the Gender Equality Authority in Sweden has got a task to do a mapping how it looks like in different regions of the country and so on. And we don't have the results from that yet, but we also have seen increased number of calls to helplines and so on. So even though Sweden has taken measures, there are still serious consequences, of course, both for men in terms of health, but also for women on other aspects of society. I would also, as I'm working on global issues, I just want to say lastly something about Sweden's global commitment. And this is truly a global challenge, I would say, which Sweden has really highlighted the importance of global cooperation through UN institutions, the WHO and others. Sweden has a strong international development cooperation, 1% of GDP for development assistance, and issues that are high on the agenda for the Swedish government are issues of gender equality, democracy, human rights, and including sexual and reproductive health and rights. So this is something that Sweden is generally pushing for in the international context, but even more in this hard situation. So this is just a way of also showing that in addition to the measures that are taken nationally in Sweden, there is also a strong global commitment coming out from Sweden, and also belief in global institutions, I would say, where we see many countries not having faith on global cooperation in the UN system, for example. So that is something that we are worrying about quite a lot here. I think that was it for me. I hope this has gave you at least a flavor of the work in Sweden. And unfortunately, I have to leave soon because we have a meeting now with the Swedish foreign minister, which is also very engaged in trade union rights and cooperation around the world. So I have to leave very soon, but thank you very much.
예, 국장님 감사드립니다.
Yes, thank you very much. We heard all the presentations from the cities, and also we have received questions from the people who will be joining us online, and we have received many questions, but because in the interest of time, we will not be able to ask all the questions to all the cities, and we'll be asking one question per city. And our first question goes to Sweden.
국장님, 그 코로나 상황에서
I would like to ask you during
COVID-19,
COVID-19, I know Sweden did not lock down. So I would like to know how care giving was done safely, especially school you said was not closed. So did Sweden did not find any infection cases at school? I would like to ask these questions to you.
Yes, no, that's correct. I mean, we did not have a full lockdown of school, but the private schools in Sweden, some of them did close and did distance learning during a couple of months. So it differs a little bit. I think, I mean, this is not general research, but just from my own experience, I know that there was quite a lot of people getting sick in schools during the spring. There was also, I think, a little bit of frightness among teachers when they needed to go and teach in school, but it differed quite a lot, while others thought it was very important to keep schools open. So I haven't seen any statistics on, the number of sicknesses among teachers nor children in school, but of course that has been a discussion topic here in Sweden, and we'll see, I think, when we look back on what did it mean to keep the schools open, and as I was saying, the universities and high schools were closed, or they had distance learning during the spring, but are now back to school again, even during the fall. So that was a short answer to that question.
예, 감사합니다.
Yes, thank you very much. Our next question goes to Ms. Eng Chong of Malaysia. Well, here in Korea, in the early part of COVID-19, well, there was a spread in religious activities, and I heard that in Malaysia there was a lot of spreading of the virus during the religious event. Was that the case in Malaysia as well?
That is only at the very beginning. Yeah, at the very beginning, there is a big religious gathering. But after that, we have very strict SOP. That means have a very good standard. Now it's become everyday life that when you go out, you have to wear a face mask. You have to keep social distancing. We are encouraged to wash our hands. Now we have specific standard operation guidelines for religious activity. Either is for whether is in a mosque or in a church or in a temple, you have to be very strictly comply to this SOP. So it's no more. Now, unfortunately, now we have a recurrent that is due to a state election in East Malaysia, Sabah. And a lot of virus has came to the Peninsular Malaysia. And now, yesterday, we have 800 over cases. In Penang, we also have some cases. I cannot remember when, but I think 2 days ago is 189. But they are mainly confined to jail, inside the jail. I don't know how how they get the COVID, how they get the virus, but in the jail. So generally there are few places are being have a conditional lockdown, but other places are still fine.
이어서 짧은
Yep.
질문을 좀 추가를
I want to
하자면
ask one more question.
말레이시아는 코로나
In
이전부터
Malaysia,
보육과 관련된
when it comes
돌봄
to
정책을
care,
지원하고
child
있다고
care,
알고 있습니다.
even before
혹시
COVID-19,
코로나
there was a support
이후에
for
말레이시아
child care.
중앙정부나
And after
코로나
COVID-19,
페낭 주에서
in the
돌봄
state of
정책을
Penang and also in
추가적으로
Malaysia,
진행하고
have you
있는
done
어떤
any
사례가 있는지
additional
궁금합니다.
care services for children?
No. But the government in Penang, we have applied one policy. If both parents are working, one of them can work from home. So there is all the childcare center are being closed. So children are kept at home. School are being closed. Children are kept at home. But the only thing is, if both parents are working, one of them can work from home. After they have to go back to work. Otherwise, when there is a lockdown for 2 months, everyone had to work from home. Besides only those who are working in the essential services. Otherwise, all have to stay home.
예,
That's how
감사합니다.
we address it.
네. 다음은 밴쿠버
Now, from
WTC 의장님께 드리는
Vancouver,
질문입니다.
chair
그
of
한국도 요즘 필수
WTC,
노동자,
currently
essential
essential
지원에 대한 논의가
workers in Korea is
시작됐고,
very
그래서
important, and we
캐나다의
are
필수
supporting
노동자 지원
essential
정책에 대해서
workers.
많은 관심이
So we are
있습니다.
very much interested
캐나다에서
in the
위생,
system
보건,
of
의료, 식품,
for essential
식료품 관련
workers.
분야 등에서
And
코로나
I
상황에서
hear
불가피하게
that
대면 노동을 수행하는
because of
노동자를 필수 노동자로
the
지정하고
COVID-19,
임금을
even
인상하는
though they
정책을
have to
실시하고 있다고
work in
하는데
the
그
normal
외에 필수
environment
노동자
and
노동 환경
meet with
개선과
people
관련된
in
여타
a
다른
person,
지원 정책이
I would
없는지
like to know
궁금합니다.
whether you have a policy or a measure to support these kind of workers who have to work and meet people in person during the corona period.
So there's different funding. There's what we say federal or national funding. There's also provincial funding. So there's a funding of supplementing their wages, especially those who work in senior facilities. The overwhelming majority of people who've died in Canada have been seniors. And the majority of those are women, actually. But not a huge majority are women, but the majority. And then there's the provision of childcare for essential workers. And that's being provided by the provincial government. So it's both the wage subsidy and the childcare that have been very, very critical for essential workers. And the priorities of all the hospitals were on COVID-19. So a lot of other work in hospitals was put off, but then it's been dealt with as the disease reduced, but now all of a sudden the virus has come back very strongly across Canada. So I think we're going to need further funding beyond what the governments had expected to provide.
예, 감사합니다. 마지막입니다.
Thank
서울시
you
여성가족재단의
very much.
백미순
And last
대표이사님께
question goes
드리는
to
질문입니다.
Ms. Beck of the Seoul
서울은 보육교사
Foundation for
지원뿐만
Women and
아니라
Family.
사회서비스원 지원 등
Here
다양한
in
분야의
Seoul,
돌봄 노동자를 지원하고 있는
many
것으로 알고
support
있습니다.
and subsidies
코로나
are being
이후를
provided
준비하는
to
과정에서
many
돌봄
different
기관, 예를
care
들면
providers.
키움센터, 다함께
There is the
돌봄센터 혹은
community
지역아동센터
child
등이
care centers and
나가야
other
될
types of
향후
child care centers.
방향과
And
전략에 대한 제언을
do you
좀
have
부탁드립니다.
strategies, as to how these centers will be operated post-COVID? I want to say three things.
이 코로나 위기 때문에
Because of
돌봄
COVID-19,
서비스를 계속 이걸 셧다운을 할 수는 없다고 생각을 합니다. 그래서
we
이게 계속되어야 할
cannot,
때에는
continue
돌봄을
to
제공하자.
close the
그리고
care services
돌봄
or the
서비스를
facilities.
받는 자, 그러니까
So those
아동이나
that
교사들의
provide the
안전이
service
굉장히
as well as those that
중요하다고
receive the services,
지금
well, our
방역
utmost
매뉴얼이
priorities, of
정교화되고
course, are
있는데
safety.
이것들을 점차
And
잘
we have
세분화하고
SOPs
그리고
or
그것을
the
훈련해서
procedures
이게 장기화될 때를
related
잘
to
대비해야 한다고
safety,
생각을 하고요.
so that
두
we need to
번째는
have that sort of guideline or the rules
이 돌봄
in
서비스가
case this COVID-19 lasts longer than we anticipate. And the care service as of now is only provided to a limited number of people. For instance, when the parents are both working, but we need to be able to provide universal care services. That's what we are aiming for. And we also have neighborhood care services. I mean, these neighborhood community or care centers where children would come and take play and rest. But now, because of the COVID, when the children come to the neighborhood care services, they study because they cannot study at schools. But we need to go back to the original goal. Yes, thank you very much. It would have been really nice if we could talk longer, but because it's a web conference, we have a time schedule that had been fixed in the beginning, so we have to abide the time. I want to thank everyone for joining us, and the video of the conference will be made available on YouTube, and the speakers' presentations, scripts, or the texts will be made available on the website of the Ministry of Gender, Equality and Family. I want to thank everyone for joining us here today. Thank you very much.